Molly, you have to go.
I'm Loftus, and I'm going to be doing a speech on PICA. Okay, to get started, let me flip through my notebook here. Alright, suppose one morning you woke up to your child eating glue. Assuming your child is just curious, you put the glue bottle away, only to find later on your child is now eating dirt. You then ask yourself, is my child naturally stupid or mentally ill? The answer is that your child may be suffering from a medical disorder called PICA. Before you freak out thinking your child is psychiatrically ill, let's examine the fact that PICA is often caused by iron deficiencies. Today we will explore the direct correlation between PICA and iron deficiency. We will also explore what PICA is, how PICA is caused, and the different treatments of PICA. Some common things people with PICA eat are dirt, ice, clay, paint chips, plaster, chalk, cornstarch, laundry starch, baking soda, coffee grounds, cigarette ashes, burnt match heads, cigarette butts, feces, ice, glue, hair, buttons, paper, sand, toothpaste, and soap. Adolescents and adults may commonly eat soil or clay, while older children eat sand, pebbles, or leaves, and younger children eat plaster, string, or paint. Symptoms of PICA include craving non-food items such as dirt, clay, paint chips, ice, glue, and a persistent eating of non-food substances for more than a month. So now that you know what PICA is and some of the symptoms, we will now explore some common causes of PICA. The actual specific cause of PICA are unknown, but some of the different theories are that number one, PICA is often caused by low levels of iron in the body. The common nutritional theory states that appetite regulatory brain enzymes are altered by an iron or zinc deficiency, which triggers specific cravings. Yet the food cravings usually do not suffice the minerals that are lacking. Another theory is that others try to fill up their stomachs with non-calorie substances to satisfy cravings when they are dieting. The physiological theory states that eating clay or dirt helps relieve nausea, control diarrhea, increase salivation, remove toxins, and alter odor or taste perception during pregnancy. Although there is no evidence supporting these actions, and these actions could be harmful for you and your body. Emotional deprivation is another cause that can lead children to PICA due to previous experiences of judgmental eating and negative reinforcement from family or friends. Another cause of PICA is pregnancy. Pregnant women often get PICA from iron deficiency. Thus, pregnant women should take an iron supplement daily. Finally, mental illness is the last possible cause of PICA. Approximately 22% of people have PICA. Although there is not a concrete diagnosis, medical evaluation is necessary. It is important to seek medical treatment if there is an intestinal blockage, as well as possible poisoning from the different cases. The doctor can use x-rays and blood tests to check for substances in the blood for any blockages. Before doctors can diagnose PICA, doctors must eliminate mental retardation, developmental disabilities, or obsessive-compulsive disorder. But this pattern of non-judgmental eating must last at least 1 month for a diagnosis to begin treatment. In fact, some cultures believe that ingesting certain substances can help them. They believe they incorporate magical spirits into their bodies. In other cultures, certain kinds of clay are assumed to be helpful for treating morning sickness, and some children may eat non-food substances to imitate a pet. Complications associated with PICA can include toxic substances, and eating them can lead to poisoning, increasing the children's risk of complications, including learning disabilities and brain damage. It can cause nutritional deficiencies. Thus, it's very critical for your child to get examined immediately. an individualized approach. Some commonly used ones are talking with a therapist to get rid of different dangers, because children with PICA are often prone to get lead poisoning, infections, parasites, and blockage. Another treatment is taking iron supplements to treat the deficiency. PICA can also be treated with counseling and behavior modification. Another useful tool is the family guidance approach, a mild aversion therapy with positive reinforcement. The outlook for people with PICA usually begin in childhood and typically last for a few months. As we have discussed, PICA is a rare disorder involving non-food items that affect 22% of children. And as we have discussed, PICA has a direct correlation to iron deficiencies, and treatment of PICA is often complex and dealt with on a 1-to-1 ratio. But overall, PICA is a rather new disorder that may be solved by simply taking an iron supplement. So today I'm going to do a demonstration, well, not really a demonstration, but kind of show you the different things that people with PICA eat. A common one is dirt. So if you all look at the dirt, that's what they like to eat, okay? Toothpaste. If your child is not brushing their teeth, but you notice the toothpaste gone, you know they're eating their toothpaste. They may have PICA. Soap is a really common one. People with PICA love soap. So you can obviously tell the importance of going to the doctor and getting evaluated if you think your child has PICA. Also, coffee grounds. They love to eat coffee grounds raw. So if anybody wants some, let me know. But often people with PICA like to eat coffee grounds. There's much other stuff, but this is what I brought to show you today, and that concludes our speech. Thank you.